James Ogoti. And James Ogoti, well done for keeping this going. We are honored to be hosting this event in partnership with the Institute of Human Resources Management and the Kenyan Counseling and Psychological Association, which are two institutions that have stood at the forefront of championing mental health awareness and professional counseling in Kenya. Ladies and gentlemen, as we gather here today, we are reminded that mental health is no longer a peripheral conversation. It is central to the national development, to organizational performance, and to the individual well-being of every Kenyan. This year's conference continues a journey we began 3 years ago, a journey that's grounded on evidence, shared experiences, and common vision, which really is that building a mentally healthier Kenya is so important, and it helps build a more resilient Kenya. So everything that we do, every conference we hold, is evidence-based, because we do a lot of research on sectors, on themes, on what goes on, and then we try to bring out a conversation to see how we can address those issues. So we just don't do random conferences, we do evidence-based conferences. Indeed, we are living in a time where global conversations around mental health are growing louder, and rightly so. Improving the quality of mental health services requires a multifaceted approach, one that looks beyond just treatment. We must focus on early intervention, widening access, implementing evidence-based practices, and creating systems that are equitable, inclusive, and sustainable. Ladies and gentlemen, back in 2023, the Ministry of Health launched the National Guidelines on Workplace Mental Wellness, a key milestone that signaled a turning point in Kenya's approach to mental health. These policies reflect growing recognition that mental wellness is deeply intertwined with our national productivity, with sustainable economic development, and with our ability to live in dignity and thrive. We must also acknowledge some sobering facts, which is that according to the World Health Organization, 1 in every 4 patients seeking primary health care in Kenya suffers from some form of mental illness. Within our Kenyan workforce alone, it is estimated that 3.7 million Kenyans out of the 24.9 active workers grapple with mental health conditions, including anxiety, depression, substance use disorder, and bipolar mood disorder. These are not just statistics. These are our colleagues, our friends, our family members, and sometimes ourselves. That is why, as a nation media group, we have chosen to leverage our convening power to create a platform for dialogue and serve as a catalyst for meaningful action. I must confess that we all have this in our families. I mean, I have a sister who went through a depression many, many years ago, and just getting her out of that situation was not easy. So I'd like just to help to just wish everybody that these are really our family. We need to stand with them. Don't think it's anybody suffering from a stressful issue is something that can be managed. I think we just have to be together in such situations, create safe spaces for them. The theme of this year's conference is improving the quality of mental health services in Kenya. Therefore, it gives us an opportunity to explore strategies to enhance access, equity, effectiveness of mental health care through evidence-based practices, policy reform, and collaborative stakeholder engagement. From this conference, we aim to share global best practices that are not only evidence-based, but are culturally appropriate. Mental health care is not one size fits all. What works in one context may not translate effectively to another. We also seek to promote prevention and early interventions in workplaces. We recognize that timely support can significantly reduce the long-term impact of mental health challenges, especially in high-pressure work environments. By fostering early awareness and equipping employers and employees with the tools to identify warning signs, we can create healthier and more resilient workplaces. In the case of the nation media, or the media, for instance, we have witnessed journalists covering conflicts, refugee crisis, climate, natural disasters, violence, abuse, and deeply emotional human stories. Sometimes they experience anxiety, depression, lack of sleep, and eating disorders, as well as burnout, trauma, and post-traumatic stress disorder. So this is actually very close to us. And this realization led us to ramp up our efforts to provide professional mental health support services for our staff, especially around traumatic events. While some of these conditions are triggered by traumatic experiences, others are situational or genetic. Our role as employers then is to ensure that we are creating awareness, avenues for open communication, and providing professional support. As I conclude, ladies and gentlemen, it's my hope that by the end of this conference, we will generate solutions and ideas that strengthen our national mental health system. From policy development to capacity building, funding, coordinated efforts are needed among government agencies, the private sector, civil society, and mental health professionals. Together, we must advocate for reforms that make mental health care accessible, affordable, and fully integrated in our public health and workplace policies. As a media house, we'll continue using our platforms not only to raise awareness, but to influence decisions and advocate broader support for mental health care. So really want to say that we will continue to support this key discussion, which I think is quite helpful. And I think it's more important. You know, I've just come from an event in the US around the United Nations conference, and on the sideline of that event, we had a we had a diagnostic, health diagnostic discussion. And the whole process, the whole issue is about how do we encourage people to go for diagnosis through checkups and all these kind of things. So I think in your basket of your health checkups, it's important that we now include psychology, just as a checkup. I'm not that you're facing any issue, but I think that having that discussion is regular with somebody who is professional in that space is so important, especially for the youth. I think the generation we are dealing with today has very high expectations, want to quickly achieve success, want different working lives, want different spaces, and these are the people we need to mentor in a special way. So asanteni sana, please, and don't forget to buy the Business Daily, which is our flagship product around this area, and there are 3 copies on the table. It's available digitally, and it's going to be available even in better ways going forward. So thank you for coming. Happy to engage with you, and I wish you all a great day and a great afternoon. And yes, let's support this sector, which I think is so important for our country. Asanteni sana.
Thank you very much, Mr. Odundo. And I'll just let you know that I have seen a counselor.